Hi, so I'm Hannah, and me and my partner Yari will be going over Duchenne's muscular dystrophy, also known as DMD. And this is our agenda. What is DMD? The signs and symptoms, occupational therapy role, our client factors, our fictional client, as well as our rationale and clinical reasoning behind our intervention. So, what is DMD? It is a progressive neuromuscular disease caused by a genetic mutation on the dystrophin gene located on the X chromosome. It is prevalent in boys with onset symptoms beginning to appear before age 6. It leads to muscle weakness and degeneration, muscle atrophy, which is replaced by adipose tissue, and it is a life-limiting condition, and many individuals with DMD do not survive beyond their 20s or 30s.
So for signs and symptoms, this is going to look different for every individual, but some of the most common ones that you'll see are delayed motor milestones, such as crawling and sitting up. A lot of these individuals, you might see that when they're sitting up, they do use what is called a Gowers sign, which is what is seen over here in the picture on the right. Pretty much, they put their hands on their thighs and use them to push themselves up to be able to sit up. They may also be experiencing difficulty walking, so you might see waddling or abnormal gait. Frequent falls and clumsiness is very common, as well as muscle weakness and contractures. They may be experiencing a lot of fatigue due to a lot of the muscle weakness that they experience. Some individuals might also be experiencing respiratory issues, learning disabilities, and cognitive impairments. And for some, and many, they will become wheelchair dependent. So for the occupational therapy role, OTs play a vital role in enhancing the overall well-being and independence of individuals with DMD for as long as possible. So what an OT will want to do is assess the client's functional status in ADLs, IADLs, range of motion exercise, their muscle strength, engagement, and leisure activities. What interventions will be looking like is they want to aim to maximize and support participation in meaningful activities. So they're going to want to do motor skill development, adaptations and modifications, depending on what it is that they're having trouble with. And because this condition is a progressive disorder, they are going to want to provide a lot of psychosocial and emotional support to the client and also to their families. So providing family education and support is very important. And also for some clients who become wheelchair dependent, the OT is also going to want to provide the client and the family education on how to use wheelchair and other adaptive equipment that's needed.
So moving on to our fictional client, Alex, he is a 7-year-old boy who is receiving occupational therapy in an outpatient clinic. He comes from a close-knit family whom all want the best for him. His mom works as a middle school teacher, and his father is an engineer. He enjoys watching his favorite movie, Indiana Jones, with them, and they live in a 2-story home in a suburban neighborhood. His parents are concerned that Alex frequently drops toys and items. He likes playing at the park with his cousins, but he fatigues quickly and often requires rest breaks. He takes a long time getting dressed in the morning as he gets stuck in his clothing and sometimes loses balance putting on his shirt. He has trouble pumping on the swings. He also has trouble keeping up with his classmates during recess and often trips and loses balance. Alex is obsessed with their golden retriever, but struggles to feed him as he loses his balance and has difficulty carrying the dog food bag.
Okay, so now that you know all about Alex, for our intervention, the 3 occupations that we focused on was upper body dressing, sensory motor play, and care of pet. So the short-term goals for each, for upper body dressing, Alex will don a t-shirt without losing balance with contact guard assist for safety within 5 OT sessions. For sensory motor play, Alex will pump the swing back and forth independently without falling, with standby assistance for safety with 8 OT sessions. And for care of pet, Alex will be able to feed his dog without loss of balance no more than 3 times, 2 out of 7 days a week, with supervision for safety, using 3 adaptive strategies by the end of 4 OT sessions. So with these occupations in mind, some client factors and performance skills that may be hindering his ability to participate in these occupations are proprioception function, decreased energy, touch functions, vestibular functions, poor joint mobility, poor muscle power, tone, and endurance. For performance factors, he may be having difficulty with reach, bend, balance, coordination, being able to move, manipulate objects, poor grasp, and difficulty with walking.
So moving on to our intervention, our adventure with Alex, we've attached our YouTube link as well as the link into the discussion board. So let's take some time to look over what we did with our friend Alex.
Okay, so now that you've seen our intervention, these are some ways to grade up and grade down the activities that were in the intervention. So for upper body dressing, to make this activity a little more difficult on Alex, is we can have him don a long sleeve shirt instead of a short sleeve. You can also have him don a tighter fitting shirt, as this is going to make it a little more difficult. To make it a bit more easier, we can have him complete upper body dressing while in a seated position, as this requires less balance. And we can also have him don a looser shirt or clothing. For the sensory motor play, we can make it more complicated by having him pick up smaller items instead of the beanbags. We can have him weave through cones while picking up beanbags on the scooter board. And we can create a more complex balance beam with turns and different level heights, as this is going to make him more difficult on him to be able to balance and coordinate his body. To make it a little more easier, we can remove the ball from the tunnel, so he's not going to have to reach as much and use as much upper body strength. We can have him pick up the beanbags without the use of the scooter board. And we can also replace the balance beam without the stepping stones. We can replace the balance beam with stepping stone blocks, as this requires less balance. For the parapet, we can place the treasure box at a higher height level, so this is going to require him to reach more. We can put the treasure in a closed lid container, as this is going to increase his hand manipulation. And to grade down, we can have him transfer less items from the treasure box and transfer bigger items to make grasping the items easier.
So now we have our clinical reasoning for our intervention. You guys can take the time to look over all of them. We'll be going over a few. So Simon says clients with DMD fatigue quickly, and we want to make sure that their muscles are warmed up in preparation for any activities that we will be doing during our intervention. We also incorporated some breathing techniques to address his fatigue. Those with DMD do fatigue quickly, and we want to ensure that we're giving proper rest breaks to give them time to get their body used to all the activities they will be doing. And teaching the energy conservation techniques such as the breathing, will be able to use that. Alex will be able to use that in his daily life, incorporating it not just in play, but during his everyday routines. For the balance beam, it also targets his praxis, and we want to work on his balance and coordination, as those with DMD do have issues with their balance as well as weight shifting due to the weakness in their muscles. And for the transferring of pom-poms, it's going to work on his fine motor skills and grasp. So those are the underlying skills that he's going to be needing when he's feeding his dog. So transferring the food bowl, the dog food into the bowl. We want to make sure that he's still able to participate in the activities that he does feel that are important to him.
Okay, and that does conclude our presentation. Thank you very much for watching and listening. And we have our references on the next slide. Thank you.